Hi everyone, welcome to researchmd.com. Today we got another orthopedic presentation. We're going to look at tennis elbow or lateral epicondylitis. Again, my name is Pramil. I'm a program director, internal medicine residency program, transitional residency program, and I teach medical students, residents. I'm also director of research. So let's get into our topic. So what is the definition, or like what is the other name? The scientific name is lateral epicondylitis, okay? It is the inflammation of micro tearing of the tendons join the forearm muscles outside the elbow. The forearm muscle tendon become damaged from overuse, repeating the same motion again and again. That's why they call tennis elbow when you play tennis. What is the most common tendon involved? Which is called extensor carpi radialis. Brevis is the most common. Other tendons involved may be extensor digitorum, you got extensor carpi radialis longus, and extensor carpi ulnaris. In epidemiology, if you look at the facts, it can affect like 1 to 3% of the US population. It's pretty high, right? Men and women, there's no big difference there. Usually lateral epicondyle affect the individuals greater than 40 years. Now, who are the people at risk? Everybody know tennis elbow, who are playing tennis, right? And then using the plumbers, plumbing tools, painters, like carpenters, cutting up cooking ingredients, particularly meat, repetitive computer mouse use, and also causes like tennis elbow. Knitting also can cause tennis elbow. The symptoms, what are the symptoms? Usually pain, everybody know that, right? Pain produced by palpation of the extensor muscles at the origin of the lateral epicondyle, okay? The symptoms of tennis elbow usually develop very gradually. There are 4 stages in the development of the injury. First, you got a faint pain at the couple hours after the provoking activity, and then pain at the end or immediately after the provoking activity, okay? Pain during the provoking activity intensifies after you cease the activity, and it's constant pain which prohibit any other activity. So signs, you look at the lateral epicondyle and the pain and point tendons of the lateral epicondyle 1 to 2 centimeter distal to the epicondyle region. And then there's pain and weakness on resisted wrist extension, and the weakness on grip strength testing. You have to use that dynamo meter and hold it. You can measure the grip strength. And pain or decreased movement on passive elbow extension and wrist flexion and ulnar deviation and pronation. Okay. Now, diagnosis, there's mainly like clinical examination. There's a couple of tests we're going to go talk about it. One's called a Mills test. The other one is Maudsley test. There's COZEN'S test. And then also you get dynamometer to measure the grip strength, okay? Then you can do imaging, X-ray to rule out some other causes like ultrasound, and then EMG to rule out mainly to any other diseases kind of going on. So X-rays, you check in to make sure there's no arthritis. And the MRI can, and ultrasound, there's a sensitivity and specificity like pretty high, 64 to 82%, 67 to 100%. MRI, very high sensitivity and specificity, very accurate test, okay? So in order, most times you don't need this expensive test to do that. Mainly, clinical examination and doing this Mills test, and the other tests will be able to come with a diagnosis. So what is Mills test? Is the clinician, the doctor, palpate the patient's lateral epicondyle with the one hand while pronating the patient's forearm, fully flexing the wrist and elbow extended. A protection of pain in the area of insertion of the lateral epicondyle is a positive test, okay? Sensitivity is around 53%, specificity is like 100%. Now, when you talk about the Maudsley test, the examiner resists the extension of the third digit of the hand, stressing the extensor digitorum muscle tendon while palpating the patient's lateral epicondyle, okay? A positive test is like when you feel pain over the lateral epicondyle of the humerus. You get sensitivity and specificity. Specificity is almost 0, but sensitivity is like 88%. Now there's another test called COZEN'S test. So you ask the patient to move the wrist to dorsiflexion, and therapists provide resistance to the movement and the position we described above. And if the test is positive, and if you feel the pain in the lateral epicondyle, if you can elicit that pain. Sensitivity is again very high, but the specificity is very low. Then you have the dynamometer, which you can measure the grip strength. Okay, and there's this questionnaire. You can use patient-rated tennis elbow evaluation questionnaire. So 15-item questionnaire, PRTEQ. is given right there. And then I'm not going to go into all the details, but it's clearly given there. And then you take the score finally, like pain score. You take the sum of the 5 pain items. The best score is 0, worst score is 50, and then you calculate the total score. And the total score is the sum of the pain plus function score, best function scores, and best score is 0. Again, worst score is like 100. Okay. So the treatment mainly conservative, right? Rest, stopping the activity, ice pack, strengthening, and anti-inflammatory medicines. Like if it is like persist, then you have to think about the other, if it lasts more than few weeks, there is a role for steroid injection. There is a role for extracorporeal shockwave therapy, and you can do this Mills manipulation. It's like a physiotherapist uses this technique. They use the small amplitude, high velocity thrust performed at the end of the elbow extension, while the wrist and the hand are held flexed. Aim of this technique is to elongate the scar tissue by rupturing the adhesions within the tenoosseous junction, making the area mobile and pain-free. Then, of course, you have this eccentric exercise called load and frequency of contraction. You can do this taping, diamond taping method by rigid tape may be used to reduce the pain and improving the grip strength. There's like flex bar exercises. Thank you so much for watching. I will be back with another presentation. Please subscribe to our channel.